Hi, everybody. Wendy Sellers here, the HR lady. I am an HR consultant to small businesses. Most of my clients that use me for consulting do not have an HR department or maybe a less experienced HR person. And so I get called in for the fun topics like, hey, we have somebody with body odor and we don't know how to handle it. Or, hey, we have somebody who isn't exactly violating our dress code, but has been wearing really tight clothes that are clearly too small for them. How do I handle this? So the one that I just got recently regarding body odor, I responded by saying, okay, call this person into a private room. Make sure that you are very direct, yet sensitive and respectful. Usually when it's the first time that it happens, that you're having this conversation, I try to make it off the record, so to speak, even though nobody's ever really off the record, and we'll get to that in a second. And I also try to just make it either the HR person or the manager who has discovered this, so it's not a big scene. You just sit this person down and say, I need to talk to you about a sensitive matter regarding your, whatever it might be, your clothing, your grooming, your body odor, or your body scent, you can say. I have noticed the following. So it's very important to say that it's coming from me, not somebody else has reported it. I have noticed the following. Your fingernails are not always clean, which is the concern for the safety of our patients. You occasionally have bad breath or an odor emitting from your body, which has been noticeable by me personally and is a professional image concern. These items must be changed immediately after this meeting. So you may have to send them home. Do you need financial assistance with this? So do you need financial assistance to see a doctor, for example, or a dentist, or to, maybe you don't have running water, or maybe they are homeless? Then sit and listen. Discuss options that you can do, you as the company can do to help this individual overcome X, whatever the issue is that you're talking about. And then also discuss if you want them to go home right now, take a break, if they can take care of it in the restroom, if they need to just start addressing it first thing in the morning. Finally, I also want to say you need to ask these individuals, do you have a disability that may be a cause of these concerns? If he or they says yes, you need to listen, and then you need to call myself or maybe a lawyer or another HR expert who knows about disabilities. A great website to go to is it's the Ask Job Accommodation Network, and they have a whole page of information specifically on body odor and grooming. Finally, I know I already said finally, but I do want to remind you that initially, you should only be having this conversation off the record, but I always make sure I go back and I write myself a note if there's an HRIS system or some kind of system where you could track notes where you're having conversations with employees, even though it's an unofficial conversation. I put it in there because I'm not necessarily going to remember when I said what or what I said to whom. And so it's very important that if it comes up again, you could pull those notes up and say, hey, on this date, 3 weeks ago, we had this conversation and you said you were going to take care of this. And so now I need to make this an official conversation where we're going to ask you to leave the organization for the day, for the week, go on leave to take care of the issue, or possibly terminate them altogether because they are violating the professional image and the grooming concern policies that you have in your organization. Make sure you put yourself in that person's because it is very embarrassing to most people. Again, it may not only be a disability concern, but it could also be a religious discrimination concern based on grooming habits of the religion, formal or informal, that they follow. Follow me more on YouTube and on TikTok for more advice. Take care. Wendy Sellers, the HR lady.